Welcome to this episode of Prescription for Primary Care. I'm Ziggy Hafeez, your host for today's roundtable discussion. Today we're exploring innovations in healthcare. Joining me are two guests, Josh Steinberg, Vice President of Business Development at Healtheon, and Dr. Ali Khan Abdulla, Family Physician. Hi, how are you today?
Good, thanks. How are you?
Yes, very well, thank you. So recently, the National released its 2024 Trends Report on Canadian healthcare. Explores integrations such as AI, which is obviously very big at the moment, the growth of virtual care, advancements in self-sampling for screenings, and challenges in communicating. So let's start by sort of exploring healthcare and AI. Josh, the article highlights Canada's leadership in integrating AI into healthcare delivery. What are your thoughts on how AI can transform patient care and operational efficiencies in Canada's healthcare settings?
Yeah, I mean, look, Canada's healthcare system has many flaws, many issues that we all are very well aware of. I think the adaptation of technology and AI should be at the forefront of every clinician, every institution, every organization, as we want to keep up with the world around us. And, our patients deserve the best that we can give them. And bringing in technology is one of those ways, creating efficiencies. What I like to say is enhancing the patient experience, because at the end of the day, unfortunately, primary care and healthcare hasn't changed from a patient experience perspective in a long time. If anything, it's getting worse. So we need to do something to curb the challenges that we are seeing and hopefully overcoming in the near future.
Why do you think it's getting worse? Like, what sort of factors do you think that has?
Specifically in primary care is the lack of doctors, the doctor shortage that we're seeing across the board, and the unattached patient population growing, exponentially every year. There's more and more physicians retiring, and very few coming into family medicine for various reasons. I think that the lack of technology might be one. The lack of funding might be another, the potential burnout that some family physicians are feeling because they don't have the support in a lot of cases. If a family physician is lucky enough to be part of a family health team or a larger organization, they obviously have it a little bit better. But for independent contractors that are running their own practice, it's very, very challenging. And, at the end of the day, we want to do whatever we can to ensure the longevity of our family physicians and healthcare in general.
So we're losing them on both ends. They're not coming in and they're leaving. And so it's there's not much left in the middle, really.
Exactly.
So Dr. Abdulla, virtual care has seen a significant growth, mainly due to the pandemic. Obviously, everyone was online. How do you think this affects the patients and healthcare as a whole?
Yeah, thank you, Ziggy, for that. I'm just going to go back to what you talked about a little bit and then bring it to the question that you have. I'd like to start with a very famous Charles Dickens quote. It's the worst of times, it's the best of times. And I'm hoping that will be our raison d'etre for what we're talking about today. Because in the middle of the tumult and the chaos that's around us and all of the bad things that people hear, there's got to be a bright light, a shining example of something that we can do. And AI is going to be that solution. And so when we're talking about virtual care, what we're talking about is the ability to take a practitioner in one geographic location and be able to look after a whole multitude of patients all over a geography and with multiple levels of scope and experience. And could you imagine if you had a problem and you were in Kenora and you needed to see someone and you were able to get access to a family doctor or a nurse practitioner, and they felt that there were other things that you required, and we could connect that to you virtually. You never have to leave your house. You never have to worry about the weather. You never have to worry about access. And we could give you the care that you required at the time that you require it and prevent you from ending up in an emergency department or, forbid the thought, an urgency of a surgery or some kind of terrible thing happened to you. And so that is the promise that I'm hoping we'll talk about today.
It sounds very promising, and it sounds hopeful. Like you said, light at the end of the tunnel. It does sound helpful because, as Josh is saying, that we're losing doctors on both sides, and if something can really alleviate that, then it helps everybody.
Yeah, I'll add something else if I may, because I know you've got some questions to do, but I really want to talk about how there are a limited number of options out there that have the ability to collate all of the power for IT solutions. And there are very few companies out there that can do that. And I want to be thoughtful about companies out there that essentially put a doctor in a little box somewhere in some kind of pharmacy, in some kind of jurisdiction, and they're there to fulfill prescriptions. That is not virtual care. That is not the prescription for primary care in the future, and that will lead to wasted resources. Only a limited number of companies have the capacity to take AI for triaging, for making sure the right practitioner is connected, to ensure the conversation happens, and that all of the little details in the work process are ensured for people to get healthcare. Healtheon is one example of that.
So you're saying there's a clear difference. Virtual care is a big umbrella basically, and you can say, okay, this is prescriptions, but this is actual virtual care, and really differentiating both of them of how thorough it is.
Yeah, and I like my colleague here, Josh, to talk a little bit about the solution that he's offering, because I really think it's important for us to understand that we're not only talking about a prescription for primary care that you see at the bottom of your screen. What we're talking about is a new process for dealing with primary care. And that's what we care about. We care about integrative, relation-based, longitudinal practice that happens in a virtual setting using AI technology.
You're absolutely right, and to that point, we're bringing cutting edge technology to a primary care setting that, as I mentioned earlier, hasn't changed in decades. And patients today are more demanding, without question. They're busier, without question. They don't have time to sit on hold on a traditional phone call to their clinic for an hour and wait. As an example, a friend of mine told me the other day, he was calling his doctor and the answering machine came on and said, "Oh, you're caller number 5 in the queue." And it took him almost 30 minutes to get through the queue to be answered, where he just had a simple question. If he can send a text message or an email or use an AI chatbot, all of those things would have made his life that much easier. And, ultimately creating efficiencies within the office setting as well is very important, because the staff don't want to be stuck on the phone all day. They want to be able to answer the right messages at the right time, pass it on to the right provider within the office. I was talking to a clinic not too long ago in Mississauga, and they have some front staff, they have some nursing staff, and the way that they're going to implement Healtheon is that according to the type of message that comes into the platform, the nurses are going to answer certain questions. The staff are going to then be able to triage between the nurse and the doctors to answer certain questions. So again, creating efficiencies within the office setting is of utmost importance to make sure that the care that patients deserve is the care that they're actually getting.
So you're talking about team-based care there, aren't you, Josh, really?
Correct.
So if the doctor doesn't need to see a certain patient, then maybe someone else can see them and then triaging them up to if they need to see the doctor.
That's absolutely right. And you can liken it to the dental model, where you have a hygienist that is doing, 90% of the work, arguably, for a patient, and the dentist is coming in at the end for the last couple minutes just to make sure that everything's okay, answer any questions specific to the patient's needs. The same thing can happen in the medical world, where you have a nurse or a nurse practitioner or a physician assistant or an international medical graduate or some type of healthcare professional that is giving their time to the patient. They're not rushing them out. They're not looking at their watch or looking at the clock to say, "Oh, I have another patient in 3 minutes. I need to get you out of here," and worrying about being behind on their day. We want the care that patients are receiving in these offices to be the most important and the focus of what those practitioners are providing. So by having a team in place, it allows the doctors to see the majorly medically relevant cases, and having the other members of the team care for those that don't necessarily need to see the doctor for a prolonged period of time, but rather just having the doctor check in to make sure that everything is being done properly.
I think that's a fantastic idea. And have you seen much of this, Dr. Abdulla?
I have, and it's done in a different type of model, right? At present, we're in a clinic where we do have physician assistants and international medical doctors and RNs and nurse practitioners. And so we scaled them through the system based on the same idea, but in a fixed geography in a fixed amount of time. So I want to talk about something a little provocative. And no one expected this, but I think it's important for us to talk about this. So you have heard that there is an increase in scope for pharmacists to be able to work on selective problems, right? Someone comes in with a rash that's fungal, you get a treatment. Someone comes in with a red eye, you get an antibiotic for eye drops or whatever, okay? That makes sense when you're valuing, you have a problem, you get a strict answer or a straight solution. But in that, there's a lot to it, right? A good proportion of people with red eyes don't actually have bacterial infections. They have viral infections, and they just need information and knowledge. And, you know, our pharmacist colleagues are working hard too. Imagine if we stop this, you have a problem, we'll fix it with a XYZ solution. Let's go back to really reimagining primary care using all the tools that are available to us in society in 2024. And actually, we're talking 2025 and 2026 because that's how far ahead we are. And if we start saying, okay, we're going to provide the tools and the experience of getting a team base that includes all the people in primary care working together to their ultimate scope and ensuring that people get the care for the problem that they need and they're followed up, and that make sure that nothing's being missed, and that we're choosing wisely, and we're using our limited resources well. Could you imagine what kind of Willy Wonka world that would be?
Sounds like you need a golden ticket for that place.
Yeah, exactly. Maybe Healtheon is the golden ticket.
I think you're definitely onto something. And implementing that through Healtheon, how easy can that be?
I mean, it's as easy as a phone call to us to say, hey, you know, what can we do, and what can you do for us in our clinic? And, you know, physicians today, I believe in my experience over the last decade plus, has always been, you know, a little bit fearful of change, a little bit, apprehensive to look at something that is quote unquote out of the norm or unusual. But that's what we all need. That's what we all are thriving to receive, is that we want something different. We want it to be, we want a different experience. You know, we don't want the same thing over and over again and expecting different results. We want something different and different results. And that's what I think that Healtheon can achieve here.
I would say if it's not broke, don't fix it, but I think it's definitely broken.
For sure.
Yeah.
Let me add to what Josh just said, because I come as a family doctor and I know my colleagues, and my colleagues are absolutely against change for the sake of change. They want to know that when they invest time and energy and resources and staff time to make sure that things are better, they want to know that the outcome is better. And so you need a good team. Just like you need a good team for looking after patient care, you need a good team for IT solutions and to ensure that what is being offered actually becomes a reality. So you need everyone on the team to be trained, everyone to ask their questions, that there's going to be bugs for all IT solutions. There's going to be bugs, but we will work through the bugs because we will learn them as the market expands and more people get involved in that. And so wherever you go and whatever you do to get this kind of care, make sure that there's a good team. I know that there is one with Josh, but other people will come to the market and they'll offer you all kinds of things. Make sure it's not about the solution. It's about the team and how it works with the solution. And that's what matters.
Well said.
Okay, thank you. So what do you think? So that's the real differentiating factor then. So because like you said, there are other people that offer similar services, but what really differentiates Healtheon from, what cuts it?
It's the team, as Dr. Ali said. It's the team that's in place to ensure that the change is as smooth as possible. And rightly so, there are going to be hiccups. Every doctor today that has an EMR or any other piece of technology in their clinic knows that something goes wrong at some point. It's just the inevitable. Who are they calling to fix that is the question. And with Healtheon, you have that team in place that's growing all the time, and there will be someone there to guide you and support you with this fundamental change that is going to bring about efficiencies and enhanced experiences and everything positive for your clinic.
And how quickly can something like this be implemented into, let's say a very archaic clinic that we've been talking about?
Yeah, within a couple weeks for sure. I mean, depending how much information we can gather and how quickly we can gather it from the clinic, but within a few weeks for sure, we can get a clinic up and running. So
it's more about mindset than anything else.
Correct.
It's telling people to switch their mindset to actually implement it.
I'll put a little buffer around that, Josh, if I may.
Sure.
So we use the term archaic, and there are people that using stone and tablets. So in that particular clinic, it's going to take a little longer to break the stone.
Absolutely.
The people that are working in pen and paper, there's going to be issues. And then with the EMRs, all EMRs are not created equal. And our intention is to make sure that the EMRs are linked in thoughtfully. There's going to be other technologies that we're going to have to bring along as well, not only just the triage and getting the right people in scope. We're going to have to be thinking about, AIs, for taking the notes in the office and turning them into notes, or we're going to have to think about billing and stuff like that. You need steps in the process. You need a good solution, and you need a good team to make sure that when the problems happen, the inevitable problems that happen every single day, even in this interview, I couldn't get my microphone working. So that happens in real life. You need to fix those problems, and you need to make sure that the team is there to make sure you're successful.
No, that's absolutely right. That we're promoting team-based care. We follow that with a team approach within our own organization, having strategic partnerships with other organizations that will bring value to the primary care office in combination with the service and product that we're offering.
Can you touch on that, on these strategic partnerships, Josh?
For sure. So one we were actually just talking about very, very not too long ago is the AutoScribe, which Dr. Ellie commented on also, that we want the patient visit to be a focus between the patient and the practitioner, whether it's the doctor or a nurse or an IMG or a physician assistant, whoever it might be. We want that, the eye-to-eye contact, the physical, touch as necessary. We want them to focus on the visit at hand rather than, being laser focused on typing a note or writing a note or trying to remember, later on that day or evening, oh, what did I see Mr. Smith for? And what did I see Mrs. Jones for? And dictating it, because we want it to happen at the time that it happened. So we have some great strategic partnerships in place to enhance the overall tech experience within Healtheon.
So they can really concentrate on that appointment, and they're not worried about, recapping later on, as you're saying. And so it captures. Actually, go ahead.
People talk about this, right? In primary care, there's your day job, and then there's your night job. And I just want to talk about that whole idea with administrative burden, right? Because you prepared the chart, you get all kinds of things that happen in the interaction. You have to go on to the next person in a very short time period. And then you got to come back and do your notes later on, and the requisition and the referrals and all the other things that need to be done. And wouldn't it be lovely if all of those things happen in a very contemporaneous way? The relationship is continued being supported. People know that their questions are being answered. They're members of the team that can go and spend time with dietitian, or they can do some physical fitness stuff, or they can talk a little bit about frailty for seniors and stuff. You could do that thoughtfully in a virtual way, in an in-person way, and then you could hybrid those two things together.
So, doctor, do you spend typically on a day that you're in practice, how much time do you spend doing your charting at after 6 o'clock, after your day's work of seeing patients?
Oh, you're going to love this statistic. You're going to love it. Are you ready? Every 1 single minute I spend with a patient, I spend 1 single minute charting. So on my Tuesday, I start at 8 o'clock in the morning and I finish at 8 o'clock at night. That's 12 hours of clinical work. I will spend the next 12 hours capturing all that information.
Wow.
Yeah. No one talks about things like that, right?
And that's what's leading to burnout and people not wanting to go into family medicine and a whole bunch of issues. And that's where the technology can come into play to be that support mechanism, so that instead of you spending 12 hours seeing patients and 12 hours charting, we want you to see 12 hours of seeing patients, and your charting is done at the same time.
And that help from the technology can really improve that efficiency, because everyone.
Number one, it ensures that you are actually involved in the conversation, in the relationship, and that you're making good use of that face-to-face time. And you're also increasing your capacity to see other people or do other work or do other learning or improve things in your practice. Those things are things that we never invested. It's sort of like, show up, you're shackled to your desk, and you just need to go through people as fast as you can, right?
You're human at the end of the day.
Yeah. I know people don't believe we're human. But we are human.
So quickly back to the article, it mentions self-sampling for conditions like HPV. What's your sort of thoughts on that? What do you think about self-sampling? I mean, this talks about HPV in particular, but other conditions as well.
Yeah, we're moving in that direction quite vigorously now. There is a proportion of people that come from backgrounds, that come from communities that don't get involved in cancer screening. And if we can do a better job of teaching and ensuring that it's done in an accurate, sensitive way, we can capture a lot more cervical cancer. Self-screening works if done with an appropriate level of education around it and insurance that it works. But so do all kinds of other things, ensuring that people get mammograms at the right time, that they're educated in regards to vaccinations, that they're thinking about, the risk factors in the behavior that they do to ensure that they don't get lung cancer, or foods that they eat, so colon cancer is reduced in probability. And what's most important about that is we're leaving sick care, reactionary end-of-life sick care, and we're moving upstream to deal with preventative care and education and improving the patient population to know what they need to do to prevent illness in the first place. And that's the future, right? That's the future of healthcare dollars.
Yeah, I mean, to that point, I think that patients, if you will, are becoming savvy. They're becoming more educated on what's going on in their world, what's going on around them. And they want that convenience factor. As I mentioned earlier, that enhanced patient experience is no longer having to come to the office to do a whole bunch of tests and waiting around for results and all that kind of stuff. There's a few companies out there now that are promoting longevity care. What does longevity care mean? It means being proactive and testing yourself for different factors or potential illnesses that are linked to your family's history or whatnot. And where are patients doing that? They're doing it at home. I think at the end of the day, if someone can be at home to do a sample of some sort, or have a practitioner come to their home to take a sample of some sort, that's much more convenient. And people are more willing, I believe, to do that rather than having to book an appointment and come in and take, 2 hours out of their day with travel time and waiting and whatnot, where they can have someone show up at 11 a.m., be done their testing at 11:15 and go about their day. That's an hour and 45 minutes that they've just saved. And that's what people are looking for. And if we can utilize technology to enhance that experience and enhance the testability or, the efficacy or whatever it is, then why wouldn't patients jump all over that?
It saves time, right? It saves time for everybody. The doctor can see more patients. The patient has more time on their hands. It goes back to the whole efficiency on every level.
And to Dr. Ali's point, it's really going to talk about, the preventative measures and keeping patients healthier so that they're not dealing with illnesses that down the road. If you can get tested and know that there's a potential issue coming up with whatever it might be, and do something to change that outcome, you're all going to win at the end of the day. The healthcare system is going to win because you're not in that system, so to speak. And those who unfortunately didn't do the testing might be, and those who do the testing and still get sick, are going to need those services. And those who did the testing and fixed themselves, so to speak, are going to be out of the system, and it's going to create less of a bottleneck.
Yeah, it's less stress on the healthcare, and it's prevention before action, right? And I think but it's just about education. That's what it comes down to, I think.
For sure.
Yeah. So I think, thank you very much. I think that sort of brings us up to the end of our time. So thank you both for joining us. This has been really, really interesting, and hopefully we'll be able to do something again in the future.
Thank you for having us. It was a great chat, and I think together as a collective, we will be changing the face of primary care moving forward.
Absolutely.
Let's hope so.
Awesome.
Thank you
so much, guys.
Right.